This is a 65-year-old male with renal cell carcinoma, status post partial left nephrectomy. The first CT on the left is the 1-month postoperative scan, followed by the 4-month postoperative scan. As you look along the surgical margin, you can see a linear arrangement of air density foci. And on the subsequent scan, you can see that these have markedly decreased. This is an example of a biologically absorbable hemostatic agent for intraoperative bleeding maintenance. These typically will have a linear arrangement of air bubbles that remain in the same position on subsequent imaging. Usually most of the agent is absorbed after 1 week post-op, but can persist even 1 month later, as in this case. In terms of differential, an abscess would appear as a rim-enhancing collection with a gas fluid level, and in some cases have a decreased nephrogram in the adjacent parenchymal tissue from edema. So this is an example of a Surgicel bolster for intraoperative bleeding maintenance.